Across Australia, there's a network of independent, not-for-profit organisations giving a voice to older people at every stage of their aged care journey. Nationally, these organisations come together as members of OPAN, the Older Persons Advocacy Network. Whether you or a person you care for is seeking aged care services or is receiving aged care services at home or living in residential aged care, our network of advocates are here to help you. Understand your rights. Resolve any issues you may be having with your provider. Help you express your needs and concerns. And we can help you access services you are entitled to. Plus, our support is free and confidential, and we're independent from both government and aged care providers, meaning we're on your side. Nationally, we also raise awareness of aged care issues, taking your voice all the way to government. To be put through to your local state or territory aged care advocacy service, call OPAN's National Support Line on 1800 700 600, or for more information, visit opan.org.au. OPAN, the Older Persons Advocacy Network.
Hello, my name's Kyle Olsen and I'd like to welcome you to this special webinar, Using Antibiotics Well. Do I need a drug for every bug? Proudly presented by OPAN, the Older Persons Advocacy Network, and funded by the Aged Care Quality and Safety Commission. Before we begin, in the spirit of reconciliation, the Older Persons Advocacy Network would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. Now, antibiotics are medicines used to treat a wide variety of infections or diseases which are caused by bacteria. They were first introduced and widely used in the 1940s and 50s, and since then have saved millions of lives. However, because they've been overused, particularly when not necessary, many antibiotics are now no longer effective against the bacteria they once killed. Now, this overuse has led to antibiotic resistance and created superbugs, where they now have little or no effect. Now, these superbugs pose a big threat to everyone's health and well-being because now there aren't any medicines to kill them. The World Health Organization has warned that antibiotic resistance is one of the greatest threats to global public health today. Now, every single one of us has a responsibility to do what we can to ensure that antibiotics are only used appropriately. Or alternatively, we could find ourselves in the same situation we were in before scientists discovered antibiotics, where people died from minor bacterial infections like strep throat, for example. So coming up today, we'll look at why antibiotics are so important and the conditions they do and don't treat. We'll identify and discuss common myths about antibiotics and look at their side effects. We'll then examine the dangers of antibiotic resistance due to their overuse and discuss why this is a major worldwide concern. We'll then look at things we can all do to stay healthy and to use antibiotics responsibly. We'll finish today's webinar with our live Q&A where we'll answer your questions. So if you do think of something you'd like to ask or a comment you'd like to make, please put them in the comment box, which is next to the video, and we'll do our best to answer as many as we can in the time that we have. Now, if after the webinar is finished you do have a specific question you would like answered, please send that query to pharmacyunit@agedcarequality.gov.au and someone will get back to you with an answer as soon as possible. Now, we'll put that email address into the chat box now. Right, to help us navigate all of this, I'd like to introduce and welcome our panel of guests. Dr. Lin Lee Lim is an infectious disease physician who is a consultant with the Aged Care Quality and Safety Commission. Welcome, Lin Lee. It's a pleasure to have you on the panel. Associate Professor Noeline Bennett is a Senior Infection Control Consultant, Project Officer at VICNUS, which is the Victorian Healthcare Associated Infection Surveillance System, and she's also with the National Centre for Antimicrobial Stewardship. Welcome, Nolene. Dr. Lisa Rogers is a general practitioner working in aged care, practicing in Melbourne. Thanks for your time today, Lisa. And lastly, Ivana McBride is the Infection Protection Control Lead at Warrawee Aged Care Service, St George in Queensland. It's good to have you on the panel, Ivana. Right, let's begin by discussing all things antibiotics, the good, the bad, and the dangerous. Now, we'd like to start off by showing you this short video, which was produced by the Department of Health, that explains the benefits of antibiotics, but also the dangers when they are overprescribed and then overused by the general public. Take a look.
Antibiotics have saved millions of lives since the 1940s, when they were first introduced. They've reduced conditions like pneumonia and infections caused by staph. Cancer treatments or surgeries like C-sections and joint replacements are commonplace because antibiotics can prevent infections that could otherwise follow. But imagine a future where antibiotics can't keep us safe. This is a real problem, and it's called antimicrobial resistance, or AMR. AMR happens when disease-causing bad bacteria become resistant to the antibiotics used to kill them. Taking antibiotics destroys a lot of bad bacteria. However, a few resistant bacteria can survive. These can multiply and spread to other people. The main cause of AMR is antibiotic use. So, while antibiotics are essential to modern medicine, the more antibiotics Australians use, and we use a lot, the faster resistant bacteria develop. Resistant infections are already causing some deaths. In a worst-case scenario, there would be no effective antibiotics left to treat infections. The good news is that AMR can be slowed if we all work to use less antibiotics. For a start, only take antibiotics that a doctor prescribes for your condition and follow your doctor's directions. Antibiotics only fight bacteria. They'll do nothing against viruses. In fact, antibiotics can give you side effects such as rash, upset stomach, or diarrhea. You don't want to risk these if the antibiotics won't help. So only use antibiotics as directed. Don't share antibiotics or save them for another time. Ask your doctor how long you need to take the antibiotics, as you might not need the full pack. We can also cut down on antibiotic use by preventing infections spreading in the first place. Regular hand washing, coughing or sneezing into a tissue or your elbow, and keeping your vaccinations up to date are simple but powerful ways to keep everyone healthy. For more information, visit amr.gov.au or speak to your doctor. Together, we can put the brakes on AMR, keeping valuable antibiotic treatments for generations to come.
Well, Lynn Lee, that video certainly gave us an interesting introduction and overall picture of the situation. But let's start at the beginning and break it down for everyone. What are antibiotics and why are they so important?
Well, to put it simply, Carl, antibiotics are medicines that have antibacterial effect and kill bacteria. So they're prescribed to treat a range of infections such as pneumonia, as we saw from the video, and infections can be mild or they can be serious and life-threatening, such as sepsis. And sometimes they're also used to prevent infections. So an example would be a patient on cancer treatment with low immunity. Sometimes they're put on a medication called Bactrim, which reduces their chances of getting serious bacterial infections. So antibiotics are very, very important because they're the mainstay of treatment for common infections, and also if we have a serious or life-threatening infection, they will save our lives. They're also a really precious resource. As we saw in that video, antimicrobial resistance is a real and increasing problem, and we need to protect our antibiotics to make sure that we don't run the risk of running out of these treatments when we do need to use them.
Thank you, Lynn Lee. Now, Nolene, one thing that we do want to make very clear is that antibiotics are very precious and powerful drugs that play an important role in keeping people healthy. Now, from your research, Australia-wide, what are the most common conditions that are treated by antibiotics, particularly in aged care?
Thanks, Kyle. Just before I give the answer to that question, I think I just need to explain, because you're going to hear us talk about sometimes antibiotics and antimicrobial. So I just want to explain the difference between the two. So as Lindley highlighted, antibiotics are drugs that restrain the growth of, or by restrain, slow down the growth of or destroy bacteria. And the terms antibiotic and antibacterial have the same meaning, but antimicrobials are a group of drugs that, in addition to antibiotics, include antifungal, antiviral and antiparasitic drugs that, in order, restrain the growth of or destroy fungi, viruses and parasites. So our research has shown in aged care homes the most common groups of infections for which antimicrobials are prescribed are urinary tract infections, skin, soft tissue and mucosal infections, and respiratory infections. The most common antimicrobials consistently prescribed are cefalexin, which is an antibiotic, and clotrimazole, which is an antifungal.
Thank you, Nolene. Now, Lisa, you're working as a GP primarily with aged care residents. Can you tell us why infections are so prevalent in aged care?
Yeah, so our elderly population are much more vulnerable to infections than younger people. Now, partly there's a lot of reasons for this. One reason is that due to chronic diseases of the heart, lungs, kidneys, or things like diabetes or strokes, cancers, all of these things can reduce people's immune system function. The other thing is that people can be on medications which can make their immune system, make them more prone to infections. There's a few different medications that can do this. Elderly people are more likely to be hospitalised, which can put them into contact with infections that they pick up from hospital. Also, with ageing, you can get changes in your immune response, and this can mean that even vaccinations aren't quite as effective as they would have been when you're younger, but this should not stop elderly people going ahead and getting vaccinations. It's absolutely essential that we get vaccinations for vaccine preventable infections, things like COVID, obviously, at the moment, and influenza, pneumococcal disease. So the other thing is that elderly people can not have the typical signs and symptoms of infection, so there can be delayed presentation. So they may present with tiredness or falls or confusion. So we have to be on the lookout for infections all the time. The other thing is that a lot of elderly people take paracetamol, Panadol, every day for arthritis, and this can mask a fever that can be associated with infections. And lastly, cognitive issues that some elderly people face can mean that they can't communicate to us when they do have symptoms. So we just have to be on the lookout all the time. In residential care, infection is more of an issue because you're in communal living and there's a lot of people around and there's more risk of picking up infections. Lastly, nutrition's really essential, and sometimes people's appetite is poor or they're not eating as well as they should due to dental problems or swallowing problems, and this can affect their immune function.
Thank you, Lisa. Some great points there. In 2019, results from the Aged Care National Antimicrobial Prescribing Survey found that on any given day, almost 10% of residents in aged care homes in Australia were using an antimicrobial, for example, antibiotics, but only around 3% had any signs or symptoms of infection. Now, furthermore, nearly 65% of residents who were prescribed antimicrobials had no documented signs or symptoms of a suspected infection in the week before they started treatment. And also, over a quarter had been using antimicrobials for longer than 6 months. Now, considering what we know about the dangers of the overuse of antibiotics and the creation of superbugs, these figures are frankly quite shocking. Nolene, from your research, why are antibiotics being overprescribed so often and at times inappropriately by medical staff?
Good question, Kyle. Look, there's many factors that can potentially influence antimicrobial prescribing practices in Australian aged care homes. Our research has shown us, and I'll just give a few examples, so I won't look to detail everything, but if we talk about workflow related factors, we have no on-site GPs to provide immediate clinical assessments. We have no on-site pharmacists to undertake regular medication reviews. There's often limited experienced nurses who can undertake accurate infection assessments that guide those decisions to prescribe antimicrobials. And often diagnostic facilities are off-site, so there can be delays in pathology collection, transport and reporting services. X-rays are rarely ordered for chest infections, partly because of the difficulty in transferring residents to an external site. If I could also talk then about cultural related factors. In regard to the resident, there's diagnostic uncertainty because of difficulty in assessing those with language barriers, behavioural problems, or those for whom there might be difficulties with their memory, paying attention, etc. Correctly obtaining a microbiology sample, so for example a sputum specimen, is often impossible. And typical infection symptoms, so for example fever, in the elderly are often not present. Lastly, just one other factor that I want to highlight, and that's pressure from families and carers to prescribe. Often there are unrealistic expectations of antibiotics being prescribed for minor symptoms and, prescribing them to try and prevent hospitalisation.
Thank you, Nolene, for that. Look, Ivana, we had a question pre-submitted by a care worker, which I thought I would put to you. They asked, what can we do when doctors continue to prescribe antibiotics because the family insists?
Well, I think the best thing we can do is remember that part of our role is we are there to advocate for the patient. And also, I think educating the families in regards to antibiotics is very important, because like us, they also have the residents' best interests at heart. I mean, they're their loved ones. So I think just open communication and not be afraid to ask the doctor, and bring this up with the family as well. Educate them.
Yeah, education is a really important point. Thank you, Ivana. Lindley, did you have anything you wanted to add to that?
I agree with Ivana. I think sometimes things in medicine aren't really clear cut. Things aren't black and white. I think I agree with Ivana. It's really important to have open communication. So one of the things that I would be keen to understand would be, what are the family's concerns? Why is the family insisting? What is their understanding of their family member's infection or condition? Have they been offered or gone through the suite of options? And some of these options might not be antibiotic related. Have they been informed of these options? Are they interested in getting more information on these options? And am I, as the aged care home staff member, in a position to provide the information, or would they like to speak to someone else? So I think that's definitely worthwhile. And I think the best way to get the best outcome is to make sure that the aged care home staff, the nurse, the GP, have looked at all the different options, have a plan, and then work together with the resident and family to discuss what are the best choices that can be made.
Thank you for that. And following on from just what you've just said, there are many preconceptions and myths regarding antibiotics, which can often lead to misuse. And like all medicines, they have the potential to have side effects. So it's important to know that when antibiotics are necessary, the benefits far outweigh the risks. But when they're not needed, you are taking an unnecessary risk. So let's look at some of the known side effects and myths regarding antibiotics. Lindley, I'll come back to you. What are some of the common myths about antibiotics?
Well, as an infectious diseases physician, one of the most common discussions that I have with patients is the belief that antibiotics are effective against all infections. And as we already noted, antibiotics are not effective against, for example, the common cold, which is a virus. The second myth that I encounter is the perception that antibiotics are needed to get better or recover from all bacterial infections. That's not the case at all. In fact, there's a whole range of common infections like upper respiratory tract infections such as bronchitis or sinusitis, where the likelihood is that you'll get better with or without antibiotics, and in all likelihood without antibiotics. The third thing that I'd like to probably talk about is a really important thing in terms of myth busting. It's the perception that antibiotics are needed if a test comes back and detects bacteria. So an example would be, if we do a skin swab and we send it to a pathology lab, it comes back and detects bacteria. Or in an aged care home setting, urine dipstick testing is a really common test that's performed because it's easy. The results are within minutes, so it's easy to do. So what I would say is that, for example, urine dipsticks, if in older people, if we perform a urine dipstick and you have no symptoms or signs, if that dipstick result comes back positive, what that's showing is that you have bacteria in the urine. Whether that bacteria is of any significance or not actually depends on whether you have symptoms or signs. So all it's showing is bacteria in the urine. And what we know is there's a condition called asymptomatic bacteria, which is really common in older people. In fact, 50% of older people will actually have asymptomatic bacteria. Asymptomatic bacteria does not need treatment. It does not need antibiotics. And if antibiotics are prescribed, the harms with respect to side effects and antimicrobial resistance greatly outweigh any potential benefits.
Thank you for that, Lindley. Look, far too often, as soon as people are sick, they ask their doctor for a script for antibiotics, thinking that they're a miracle cure for everything. So Lisa, what conditions should not be treated with antibiotics, and what other causes of action should be considered?
So it's not always necessary to treat infections with antibiotics. Often there can be ways that you can manage them without resorting to antibiotics. So for example, this slide's very useful. A lot of this is overlapped with what Lindley has just spoken about. So many upper respiratory tract infections that are caused by viruses. So viruses don't respond to antibiotics. They generally settle with rest, increased fluids and paracetamol. Some bacterial infections that get better quickly even without antibiotics, such as upper respiratory tract infections such as bronchitis, sinusitis and ear infections. Just as with viral respiratory infections, these usually settle with rest, increased fluids and paracetamol. Expectorants are often useful, as are simple strategies such as elevating the head of the bed. So lots of old-fashioned sort of things can be really helpful. Harmless bacteria in conditions where there are no symptoms or signs of infection. An example of this is an uninfected skin wound. These generally settle with regular cleaning and dressing if indicated. Redness in skin creases often responds to careful hygiene, drying of the skin and application of barrier cream daily. Nutritional improvement with vitamin C and dietary supplements can be used as well to assist wound healing. When used, antibiotics when used for prevention of infection, such as antifungal creams used for months or oral antibiotics started just in case infection might develop. There's no reason to use preventative creams or antibiotics for most infections. This can lead to the body developing resistance against treatment used, which can reduce its effectiveness over time. Preventative antibiotics are indicated for some very specific infections, such as recurrent urine infections. Some other examples of infections that antibiotics are not needed, such as asymptomatic bacteria, which Lindley has talked about. So if bugs are detected on urine culture but the person is well, that doesn't need any treatment. gastroenteritis is nearly always caused by a virus. Even when it's caused by bacteria, it usually will settle just with rest, increased fluids, and a bit of time, and obviously isolation from other people. And the other thing is mild conjunctivitis. It's often due to people rubbing their eyes because their eyes are a bit itchy and sore due to just dry eye syndrome, which is part of aging. So if you use regular cleansing wipes or cool boiled water to clean the eyes in the morning, and then regular use of lubricant eye drops, you can often stop the eye infections even starting because you're not rubbing your eyes anymore. So there's some examples of infections that don't need to be treated with antibiotics.
Thank you, Lisa. Thanks for those hints and tips. Ivana, what are the possible side effects or serious risks associated with antibiotics, particularly in older people? Just got you on mute there, Ivana.
Sorry. Some of the most common side effects are nausea, diarrhea, and this is really significant because these people already have decreased appetite. It's really hard for some of them to get that adequate nutrition, and this really makes it much worse. Also, to take into consideration, a lot of residents have swallowing difficulties, so the antibiotics have to be removed from their coating, which makes them taste really bad, and this further increases the nausea and really makes it hard for them to, consume adequate amount of food and fluid. It's thrush is also another really bad one. So those would be the top ones.
Thank you very much for that. So look, as we've heard, certain conditions can get better without the use of antibiotics. Ivana, can you give us an example where you might use a different type of treatment instead of prescribing antibiotics?
Well, for example, wound dressings. Like if you have a pressure injury, you really, before you go down that route, you need to consider, like, are we doing everything initially to prevent it? Are we repositioning people adequately? We need to review the nutrition. Are people getting enough of required, stuff that they need? And also there is a really large variety of very good antimicrobial dressings that can be used, like honey impregnated dressings, silver dressings. So I think we have a lot of options these days before we go down the route of antibiotics.
Yeah, that's a really important point there, absolutely. Look, antibiotic resistance is something we all need to be concerned about. There has been a dramatic increase in multi-drug resistant bacteria in the last few years. Now, this is happening in the community and, of course, in residential aged care, where some superbugs are now either virtually or completely untreatable. Currently, 700,000 people worldwide die each year from resistant infections. Now, that number is set to rise to 10 million every year by 2050 if no action is taken. Nolene, what is antibiotic resistance and why do we need to be concerned about it?
Yeah, thanks, Kyle. I'm going to start with what it's not. So antibiotic or multi-drug resistance does not mean that someone or their body is becoming resistant to antibiotics. What it does mean is that the bacteria are changing itself to protect itself from an antibiotic. So I think that point needs to be made really clear. Antibiotic or multi-drug resistance can occur naturally, but, and this is the big but, misuse of antibiotics in humans and animals accelerates the process. The more we use antibiotics, the more chance bacteria have to become resistant. So we need to be really concerned, obviously, and as has been noted several times now, that's because it's becoming harder to treat as the antibiotics used to treat infections become less effective. We need to change the way we use antimicrobials, antibiotics included. Thanks, Kyle.
Thank you, Nolene. Lindley, I'd like to hear more about this. Can you give us an example of an antibiotic-resistant infection and how someone might acquire this type of infection?
Yes, Carl. I'd probably like to talk about Staphylococcus aureus. When I first started my career in infectious diseases about 20 years ago, we were becoming aware of increasing problem of resistant Staph aureus. So we commonly call it golden staph. But it was primarily a hospital acquired disease. So people would go into hospital and then they would get the infection. So we weren't really seeing much in the community or in aged care. But in the years since then, Staph aureus and golden staph has become an increasing problem. And currently in aged care, what we know is 1 in 3 golden staph will be resistant. 1 in 3 Staph aureus will be resistant, so it'll be golden. The rates of golden staph are higher in aged care than in community or hospitals. So what does this tell us? Well, it's a problem because Staph aureus is a bacteria that normally lives in our skin, so we have it on us. And where it becomes a problem is if we get an infection related to Staph aureus, because it's golden staph, we're more limited in our antibiotic choices. So instead of being able to use first line, second line, or third line drugs, we're limited to only a small number of oral antibiotics or strong intravenous antibiotics to treat.
I think we've lost Lindley there. Lindley, if you can hear us, if you could just reconnect, that would be great. Nolene, I'll move on to you. Lindley touched on this. Is the likelihood of getting an antibiotic-resistant infection higher in residential aged care?
Well, the first thing...
Sorry, one moment.
Residents of aged care facilities with high antibiotic use certainly have an increased risk of antibiotic-resistant colonisation and infection. Now, if I can just explain colonisation, that's where there's the presence of bacteria on a body surface, like the skin and mouth, but there's no disease, there's no symptoms of that disease in the person. So that's the difference between colonisation and infection, where you do have signs and symptoms, obviously, for an infection. So this increased risk in our aged care homes includes residents, and this is really important to understand too, residents who are actually not receiving the antibiotic therapy. They're at risk because transmission or spread of colonisation infection can easily occur from one resident to another due to the close living proximity. You know, we're all very close in our communal areas, and also not just resident to resident contact, but of course staff to resident contact. Also for our residents, they're at greater risk because of the regular transfers from their aged care home to an acute care hospital.
Thank you, Nolene. Now, Lisa, what actions can healthcare professionals take to reduce antibiotic resistance?
Well, there's a lot that health professionals, including GPs, can do, especially with prescribing. So firstly, the slide, what you can do, really talks about what we as a profession can do. So the first thing would be to consider a safe alternative to an immediate antibiotic prescription. So for many mild infections, it can be appropriate just to wait and see and delay antibiotic treatment while seeing if simple non-antibiotic treatments are effective. Some examples are simple measures such as rest, increased fluids, paracetamol, and for skin infections, regular cleaning and dressing. If these are not effective or the person's more unwell, then antibiotics can be commenced. The second thing would be to prescribe in accordance with therapeutic guidelines and, where possible, use diagnostics to inform treatment decisions. So this means, wherever possible, taking samples, the microscopy and culture, and the results will help guide management. Avoid treating asymptomatic infections and avoid writing as needed prescriptions. If antibiotics are needed, use the shortest course, which will treat the infection, and ideally use one which is specific for that infection, rather than one that would cure many types of infection, as the specific ones are less likely to promote antimicrobial resistance. Talk about the importance of appropriate antibiotic use and the dangers of antibiotic resistance. So keep the use of antibiotics for when it's clinically indicated and the person is unwell. It's important to finish the whole course, as otherwise this may contribute to the development of resistance, and that antibiotic may be less effective for you in the future. Give advice on how to manage symptoms without antibiotics. So there's plenty you can do. So simple measures: rest, increased fluids, paracetamol for skin infections, regular skin cleaning, moisturisers for dry skin, dressing of wounds. Applying best practice infection prevention and control. So for staff, for doctors and aged care staff, the use of careful hand washing, use of hand sanitizer before and after resident care, the use of masks to avoid droplet spread of infection, which is obviously incredibly important at the moment. Assisting residents with activities such as good hand hygiene and general hygiene where they can't do this independently. So regular continence pad changes, careful cleaning during showering, careful drying, the application of barrier creams. And talk about how to prevent infections and their spread. So the importance of vaccination, good hygiene and hand washing, good diet, hydration, help your immune system to function well. And avoid contact with people who are unwell and staying in your room when you're unwell, especially with respiratory and gastro infections that can spread rapidly when you're in communal living.
Thank you, Lisa. Now, for more information about antimicrobial resistance, please do head to amr.gov.au and then just do a search for aged care. Ivana, how can aged care staff, let's say registered nurses, support a culture where antibiotics are used more appropriately?
Well, I think first of all, we should, when someone presents with a potential, for example, UTI, which is the most common infection in aged care, we should consider what other factors could be causing the symptoms. Do they have any new medication they've been commenced? Are they constipated? Do they have some pain that is not addressed? And we should always try and obtain a sample before we commence them, before the doctors commence them on antibiotic therapy. And I really think it's very important to facilitate the culture of open disclosure and good communication, and encourage patients to ask the question from the doctors, why am I being prescribed this? Is there any alternatives? And also encourage staff to feel free to question. I think that is one thing we have to do.
Thank you for that, Ivana. Look, the Aged Care Quality and Safety Commission has produced a pamphlet called Do You Need Antibiotics? Now, it has information about antibiotics for aged care residents and their families, carers and representatives. It's really easy to read and is free to download by going to agedcarequality.gov.au and then searching for antimicrobial stewardship. Look, we've taken a lot of information for today's webinar straight from the pamphlet. So Lindley, can you walk us through the pamphlet and run through the questions you should ask your doctor if you've been prescribed antibiotics? Because I really think this is something that we should all take into consideration.
Thanks, Carl. Yes, the pamphlet goes over much of what we've already touched on today. What are antibiotics and why are they important? What are they used for? What are they not effective for? And what are the possible side effects and harms related to antibiotics and what you can do to stay healthy. There's also an important section that I'd like to draw your attention to on questions that you should ask if or when you're being prescribed on an antibiotic. And I would say that even if you've been on this antibiotic for a long time and you're not quite sure what it's being used for now might be a good time to actually review that with your doctor. So some questions that you might want to ask your doctor: what is this antibiotic? What condition is it being prescribed for? Can it get better without antibiotics? What tests have been sent and how will they be used to help diagnose the infection? Are there any other alternative treatments and care recommended for my condition? And also, what are the risks of this antibiotic? As well, you might also want to ask, how long do I need to take the antibiotic? And if it's just been started and the doctor's waiting for tests to come back, you might have to, it might not be a clear plan at the moment, but if you've been on it for months, there should be a clear plan in place already. As well, it's important to ask or know about how should I take the antibiotic to make sure it works well. Some antibiotics work best if they're taken in the morning or at night. Some work better with food or on an empty stomach. Also, how will it interact with my other medications? So warfarin's a good example. It's a blood thinning agent that's commonly prescribed for cardiac conditions such as atrial fibrillation and interacts with a whole range of antibiotics. So that's a good question to ask.
Yeah, great. Thank you for that, Lin-Lee. Some very important questions and well worth sitting down and having that talk with your GP. Lisa, what are some ways older people can stay well and reduce their risk of infection, thereby reducing their need for antibiotics?
Well, there's plenty that elderly people can do to stay healthy. The first thing I would say is it's important to make sure that you stay well hydrated, drinking plenty of fluids, whether it's water or other fluids, in addition to whatever tea or coffee that you're having. It helps your immune system to work optimally. The other thing is adequate nutrition. So older people should eat a varied diet with plenty of protein and fruit and vegetables. Sometimes dietary supplements can be useful if you feel your diet may be lacking. Performing hand hygiene frequently, so washing your hands with soap and water after going to the toilet, and washing your hands or using alcohol-based hand rub before eating or touching others. Insisting that healthcare professionals and visitors clean their hands before touching you or caring for your wound. I think that's a reasonable question for people to be asking, especially at the moment. It's important to be aware that you do have the right to ask that. Covering your cough to prevent the spread of germs. So that means coughing and sneezing either into a tissue or into your sleeve or elbow. So to stop the bugs getting out into the air and being breathed in by somebody else. Coughing into your hand is not ideal, as the bugs can be spread to anyone or anything you touch. Asking friends or family not to visit when they don't feel well, staying in your room when you're sick, because infections can spread quickly with communal living, and protecting yourself by getting vaccinations for flu, COVID and pneumonia, and encouraging others around you to do the same.
Absolutely. Thank you very much for that. And please, everybody, go out and get that COVID vaccine if you haven't already, as soon as you can. Nolene, Ivana and Lisa, can I ask each of you for the main message you would like to give to older people and aged care staff about how they can make a difference? Nolene, I'll start with you.
Thanks, Kyle. I'll keep it very simple. I think it's important to re-emphasise clearly everyone has responsibilities, not just general practitioners, as I've been told before. To older persons and aged care staff, learn about how to appropriately implement practices that can, one, prevent and control infections. So we've spoken about hand hygiene, about respiratory hygiene, etc. And number two, to improve antimicrobial use. So just on that last point, from this presentation today in regards to improving antimicrobial use, the questions that Lin-Lee listed and are included in the new Aged Care Quality and Safety Commission pamphlet really should be asked for every antimicrobial that might be or is prescribed.
Thank you, Nolene. Ivana, I'm going to come to you now. What is your key message you would like to leave with everybody?
Well, I would 100% agree with Nolene. I think the most important thing is we have to move away from the culture where antibiotic is first go-to, treatment. And I think we really have to ask questions, why is there anything else? Before, that should really be our last option, not our first option.
Thank you, Ivana. And Lisa, I will come to you. What's your message for everybody?
Well, I agree with what Ivana and Nolene have both said. I think antibiotics are incredibly useful and valuable and even life-saving, but they should be reserved when simple things are not working, the simple measures, and the person's becoming unwell. And the other thing is that elderly people have a lot of power themselves. They can keep their body as healthy as possible just through good nutrition, hydration, and getting immunisations to reduce their risk of infection. And just for the aged care staff, use of infection control, things like hand washing, masks, and importantly, careful hygiene measures when you're assisting the elderly with their own hand washing, personal care, cleaning and drying, barrier creams. They're just simple means to reduce their chances of infection.
Thank you, Lisa. Thank you to all of you. Look, let's have a look now at some of the questions you sent through when you registered for today's webinar, and then we'll go to our live Q&A. We want to get through as many questions as we can, so I'll just ask the panelists to give as short, sharp and concise answers as they can. The first question I have is from Robin, and Lisa, I'll put it to you. She says, my mother has late-stage Alzheimer's and resides in a secure memory unit. UTIs make her agitated. When she returns a positive urine sample, the nursing staff want to put her on antibiotics, but the GP is reluctant to do this on a regular basis as he's concerned about causing other problems such as thrush. However, I've actually observed her after being on antibiotics and she's definitely more settled and happy. I just want her to be comfortable. Is there a long-term option which will keep the UTIs at bay? Lisa?
Yes, there is. There's good news that there are options for elderly people who are suffering with these issues. So the first thing I would say is that infections that are symptomatic should always be treated, and worrying about the risk of side effects such as thrush should not be a reason to not treat if somebody is unwell or distressed, agitated with symptoms. So I think it's very important to collect a clean sample of urine, be sure what you're treating, treat the infection. If necessary, you can give antifungal treatment at the same time, which is really useful. If the person has had recurrent urine infections, then it would be very useful and would improve their quality of life to put them on a long-term course of low-dose antibiotics. So it's only a small amount of antibiotic, much smaller than the usual treatment dose, and it's given every day. Usually this doesn't cause side effects such as thrush or diarrhea, but if that was an issue, that thrush was occurring with long-term antibiotics, then you can use long-term antifungal treatment too, using once-a-week creams or once-a-week tablets to prevent the thrush developing. So there are options, and it's really, really important that these people with cognitive issues are not denied help for infections that are making them very distressed.
Absolutely, thank you for that. Look, Nolene, following on from that question, Stephen has asked, when should preventative or prophylactic antibiotics be prescribed?
Yeah, so thank you, Stephen. This is an excellent question. So prophylactic antibiotics may be prescribed if there is a significant clinical risk of a bacterial infection developing and the benefits of that prescription outweigh the risk of harm. Prophylaxis may be to prevent an initial infection, such as post-surgical procedure, or to prevent, as occurs often in our aged care homes, to prevent the reoccurrence or reactivation of an infection. There's several guidelines in Australia that provide practical advice on managing a wide range of infections, and they are the Antibiotic Therapeutic Guidelines and the Australian Medicine Handbook Aged Care Companion. And both guidelines emphasise, where possible, non-antibiotic strategies should be used first to prevent urinary tract infections, for example. For those with recurrent UTIs, an alternative approach to continuous prophylaxis, and there's a lot of active discussion about this in the medical community, is suggested, and that is to complete an antibiotic course only at the onset of symptoms, and this may actually reduce the overall antibiotic use. If continuous prophylaxis is used for urinary tract infections, for example, typically it should be frequently reviewed and stopped before 6 months. If UTIs were to reoccur despite prophylaxis, expert advice is to be sought.
Thank you, Nolene, for that.
Great question, Stephen. Thank you.
Thank you. Now, Lynn Lee, Charmaine has asked, are there any compliance or reporting obligations when prescribing antibiotics in residential aged care homes?
Thanks for that question, Charmaine. Each service will have their own process and procedure in terms of ensuring that medications are being used appropriately, and that would include antibiotics. With respect to compliance and reporting obligations when prescribing antibiotics in aged care, the National Aged Care Mandatory Quality Indicator Program does have an indicator around medication management. That's specific to polypharmacy and antipsychotics, so around the polypharmacy indicator, antibiotics will be covered.
Thank you for that. Now, Ivana, Sally has written, I've worked in some residential aged care homes that do regular monthly urine dipstick tests of all residents, regardless of whether they're showing any symptoms. Is this a good practice?
Well, first of all, thank you for the question, Sally. In short, no, this is definitely not a good practice. As Dr. Lindley said earlier, most of the people who live in aged care facilities have asymptomatic bacteria, and when we do the dipstick test, they will give false positives. So I think this is a really, really bad practice. I'm just gonna give an example. I work in rural Queensland, and for us, sometimes even when we send urine, it can take up to 5 days to get the results. So if we were to conduct these random urine tests, we would, have to commence people on antibiotics prior to receiving the samples, the results of the samples back, which really is all like goes against everything that we talked about today. So I would say no, that is definitely a very bad practice.
Thank you, Ivana. Lisa, the last question that we have for you before we move on to our live Q&A comes from Debbie. She says, do you have any suggestions on how to collect a clean urine sample when the resident is incontinent?
That's a great question, Debbie, and that's something that we encounter every day working in aged care facilities. The good news is that there are options. It is important to collect a clean sample, which avoids contamination from skin bugs or bowel bugs, which may confuse the results. So one option is for women. We can use an in-out catheter, which is a gently inserted urinary catheter, inserted and then obtain the urine sample, and then the catheter is removed. It's not painful a procedure. It's a little bit uncomfortable, but it's over very quickly and it gives us a urine sample. For men, it's an easier option. After careful skin cleaning, we can apply a condom and actually collect the urine sample in the condom once the resident passes urine, and then that sample can be sent off to pathology. So there's lots of options, and we shouldn't be just making a best guess. We should always attempt to collect a sample.
Thank you very much, Lisa. Now let's have a look now at some of the questions that you have sent through for our live Q&A. The first question has come through from Sean, and it's for you, Lisa. I find one of the biggest challenges in antimicrobial stewardship is GPs who prescribe antibiotics based on resident requests for non-specific symptoms, if any. What tips do you have for getting our GPs on board?
Oh, it's a really tricky one. I think taking a good history, doing an examination if necessary, doing tests. It's so easy to prescribe an antibiotic without getting all the information, but the more information you have, the easier it is to make the decision. I think education of GPs about antimicrobial resistance is essential, but it's an ongoing challenge.
Thank you, Lisa. We've had a question come from Danny for Lynn Lee. What evidence is there for long-term use of antibiotics in chronic wounds, such as venous or arterial wounds, with symptoms such as pain?
Thanks for that question. There is actually poor evidence that it's effective in terms of preventing preventing infection, because if the wound's not infected, if the ulcer's not infected, that's all the antibiotics are doing. It's preventing infection. But what there is good evidence of is that the risk of side effects is high. So 1 in 3 people will get side effects from antibiotics. And there's also good evidence, as we know, that antimicrobial resistance is more likely. So if that wound does become infected in the future, if they've been on these long-term prevention antibiotics, we've probably lost these antibiotics as an option in terms of using it to treat the infection.
Thank you, Lynn Lee. Nolene, I have a question from Kay that she's actually emailed in to us. It's a little long, so I'll read through as quickly as I can. In discussions with family, I have been able to dissuade commencing antibiotics whilst the resident had low-level symptoms until cultures are returned. The problem is that it doesn't take very long for minor infections to lead to sepsis, which then requires hospitalisation as the resident becomes too drowsy to eat, drink and take medications. If sepsis occurs, we are under a high degree of scrutiny for not having started antibiotics sooner. The tipping point can be so quick, particularly if deterioration occurs overnight. Then the next day the resident needs a hospital. Is there a decision-making flowchart for best practice that might support decision-making in terms of prescribing antibiotics?
Yeah, thank you. Just in that scenario, I think the key here is any resident that may have initially minor signs and symptoms needs to be observed closely, so that traditionally in our aged care homes we don't do regular clinical assessments, but if a resident is to have has a minor infection, that's the time where we need to be doing regular clinical assessments. So that's the first thing to say. Second is there are sepsis pathways. Now, to you, Kyle, off the top of my head, I don't have the link here to be able to share, but I can forward that to you if you want to forward it to participants, where there's certain signs and symptoms that you're looking for. And with that, what I would say to aged care staff, your residents, very quickly when you're doing those observations that they're deteriorating quickly. More so in some ways than if I was standing alongside you, you will pick up on things that I might not, that leads you concerned enough that you need to contact the resident's general practitioner. But Kyle, I'll look to send a link for a septic pathway to you post this, and are you able to forward it on?
Absolutely. We will be sending out an email to everybody who registered for today, and we will be able to pass on that link. So if you can get that to me, we'll make sure it gets out to everybody. Lindley, I've got a question from Sally. I work in a home as a home care worker. What steps can we do to help our residents in their own environments to manage symptoms without antibiotics?
That's a great question. I think if the first thing is to make sure that we're comfortable that that we're not dealing with a serious infection, because if it is a serious infection, then they need to see their GP straight away or consider hospitalization. But if it's a mild infection, as Lisa has already discussed, there are many ways to actually manage symptoms so that you feel better with or without, even without antibiotics. And then the third is to make sure that they're comfortable and confident that they have kind of like an action plan in place. So if this symptom gets worse, this is what you should do. If otherwise, it's just regular monitoring. So to feel that they're comfortable and supported.
Thank you so much, Lindley. Now remember, if you would like more information, you can always download the brochure that's been produced by the Aged Care Quality and Safety Commission by going to agedcarequality.gov.au and then doing a search for antimicrobial stewardship, and you'll get the brochure, Do You Need Antibiotics? We do recommend that you all have a look for that one. Look, that's all we have time for today. We would like to thank our panel members for their time and expertise. Lindley Lim, Nolene Bennett, Lisa Rogers and Ivana McBride. Thank you to all of you. We'd also like to thank you for joining us and for the questions that you sent through. Please remember, if you do have a specific question you would like answered, you can send that query to the following email address: pharmacyunit@agedcarequality.gov.au, and someone will get back to you with an answer as soon as possible. Today's webinar will be on OPAN's website in the coming days, along with all our past ones. So if you missed something or you know someone who should watch it, then please let them know, as we'd love to be able to help them. Now, our next webinar will be held on Tuesday, the 31st of August at 11:30 a.m. Australian Eastern Standard Time, and we'll be discussing disabilities and ageing. We really hope you can join us for that one. Till then, stay well, stay connected, but most importantly, look after each other. Goodbye.
This webinar is proudly brought to you by the National Network of free, independent, not-for-profit organisations across Australia, giving a voice to older people at every stage of their aged care journey. OPAN, the Older Persons Advocacy Network.